All right, so we will get started. Welcome everybody who's tuning in live for another EBFA educational webinar. Very special thank you for taking the time if you're listening live. And if you are tuning into the recorded version, welcome. Thank you for your time as well. A little bit of housekeeping before we get started into the webinar is if you are new to EBFA webinars, all of our webinars are recorded. They're all archived and you can be found, you can find them on the YouTube channel, which is youtube.com/EBFA Fitness. You will see probably now over 40 webinars. All of them are great from myself, from guest educators, so do please check out the YouTube channel to see the archived webinars. The lecture part of it will be probably around 30 minutes, and then we'll go through some questions where you can type those in. So if you look at your control panel to the right, you'll see an area where you can type in the questions, and we will be sure to go over those at the end. And then we will try to kick these off again and have them regularly once a month. So here we go. We're getting started. This webinar, we are focusing on optimizing power of propulsion, where we're going to be looking particularly at high gear versus a low gear push-off. And if you are new to those terms, then we'll learn a little bit more about how each of those can impact power production, obviously push-off, and the kinetic chain through our closed chain movements. So what's important is, even though in the first slide here, I have pictures of runners, and we typically think of propulsion and push-off. A lot of us do think about runners, but I want you to realize that this webinar is not focused just on runners. It's not just speaking about walking. It is about every single closed chain movement that we do. So if you are working with divers, or you're working with gymnasts, or you're working with swimmers here in this image, you always have to be thinking about how are they releasing that energy from the ground. What is that, not just the contact phase, but what is that relationship with the ground when they are pushing off? Because that's really where a lot of our power lies. So it's not just about runners, it's not just about athletes as well. So every single one of your clients, you want to be thinking about that foot and ground interaction. How are they releasing their power? Even if they're doing just exercises in a group exercise setting, how does that foot position affect power output? So we often think about the foot with or related to contact and impact forces, where there's a lot of attention on overuse injuries and impact injuries, and our contact to heel strike should be midfoot strike. We're not looking at anything related to that. Today we want to be focusing on that push-off position, what's happening in the distal aspect of the foot, which means that we're going to be talking about the great toe joint, and how does that great toe mobility really impact your power output. And you can optimize your client and your athlete's power output by zoning in on that great toe and optimizing that position, because that's really the last contact between the body and the ground is going to be that big toe joint. So we want to optimize that position. So we know, and we often hear, that our power lies within the transverse plane. A lot of lectures I was at Perform Better this year in Rhode Island, and I was in NSCA, and there were a lot of lectures focusing on that transverse plane. Here, if you look at this image, you could see this is a transverse plane rotation. We often think about transverse plane, and then we go right to the core, and we think about rotations within the core, but we think a little bit about larger movements that we're doing in that transverse plane. Yes, rotations lie within the transverse plane, but you also want to think about power output in the transverse plane as it relates in that whole lower extremity. So think about it a little bit more like a spiral. So here we want to think about tapping into your lower extremity power through the transverse plane. So that transverse power comes through a spiral that is driven from the ground up. And it's a spiral that is driven from that great toe joint all the way through the subtalar joint into the ankle, into that tibia, knee, femur, hip, etc. So we really, really want to see how we can optimize that transverse plane spiral. So what's happening when we are in the propulsive phase of push-off, whether it's in gait, walking, running, jumping, etc., this is the position that your foot is going to get into. So we can see that there's a lot of joint coupling that's going on. The joint coupling that we want to see and the joint coupling that optimizes power output is going to be hallux dorsiflexion. Anytime you dorsiflex your hallux, you start to tap into your plantar fascia. If you're not familiar with your plantar fascia, it is the connective tissue that runs along the bottom of the foot. It originates on the medial or the inside aspect of your heel bone, and then it fans out and it inserts into all 5 digits, even though we particularly focus on the great toe, but it inserts into the distal digits. So if you do, and a quick way to understand this is if you feel the bottom of the foot now, if you happen to be barefoot or you want to pop your shoes off, if you feel the bottom of the foot with your foot relaxed, you really can't feel your plantar fascia. As soon as you bend your big toe back and you keep your hand on the bottom of the foot, you'll feel your plantar fascia pop out or tighten or activate. That really is the powerful connection that's happening between the great toe joint and the subtalar joint. Great toe joint, subtalar joint, very much linked, especially as that translates to power. So because your plantar fascia originates on the inside or medial aspect of the heel bone, it is going to create subtalar joint inversion. So inversion of the heel or inversion of your subtalar joint is coupled with that hallux dorsiflexion and is really driven through your plantar fascia. That is referred to as the windlass mechanism. So windlass mechanism is dorsiflexion, great toe, tighten plantar fascia, invert or lock the subtalar joint. We also know that subtalar joint inversion is coupled with tibial external rotation. So anytime you invert the subtalar joint, that causes the tibia to externally rotate. Because we're also moving into an ankle plantar flexed position, ankle plantar flexion is coupled with subtalar joint inversions. You have several joint couplings that are happening at the exact same time. Knee extension, which is also part of that power phase or propulsive phase or that release phase, knee extension is coupled with tibial external rotation. So it's both the knee extension, the plantar flexion, the subtalar joint inversion that is driving tibial external rotation. If we continue up the lower extremity, hip extension, which is also what we're going after with the power phase, is coupled with femoral external rotation. So we know that the most powerful lower extremity muscle that we're going after for power output, maximal power output, is going to be our glutes. So if you can see how all of these are influenced, so hallux dorsiflexion is actually going to drive the activation of your glutes. You actually can tap into your glutes a little bit more when you emphasize hallux dorsiflexion, subtalar joint inversion, knowing that those two joints drive the spiral of external rotation. So that's really the power that we're going into. So it's not just hip extension drive into those glutes. Think much more external rotation, transverse plane power. So what is often the limiting factor of our lower extremity spiral or power? Again, think a runner, think a vertical jump, think about that sprinter pushing off of the blocks or a sprinter, a swimmer that's switching directions in the water. It's going to be your big toe. Of course, I had to borrow Dr. Perry here. He calls this his big toe mojo, and he talks a lot about the great toe joint. There's a lot of professionals who are now talking about the great toe joint. We really want to delve into it a little bit deeper because it's not as simple as bend the big toe back. I get a lot of patients who are referrals after they're working with practitioners and they're just frustrated. They're like, I don't know. I can't increase this dorsiflexion. I'm doing mobilization. I'm stretching it. I'm putting a little wedge underneath my great toe, but it's still not getting me optimal dorsiflexion to do maximum power output. So we really have to focus on that great toe joint and look at the biomechanics. They're not as straightforward as you may think. So we're looking at the great toe joint here. If we look at the x-ray on the left, this is actually not an awesome x-ray on the left. But what we can see is that you have your first metatarsal, which is here, the first metatarsals. These long bones in the foot are called the metatarsals. These are the phalanges. So all of these little joints right here, these are the knuckle of your foot, or the lever of the foot. Those are referred to as your MPJs. So your first MPJ here is going to take a lot of that load, and that's where you need that maximum dorsiflexion. For optimal movements, for walking, you need at least 30 degrees of dorsiflexion. What 30 degrees of dorsiflexion looks like, closed chain, is if you are standing and you can put your finger under the big toe joint, your finger thickness is approximately 30 degrees. So that's an easy test for that. If we look here at this x-ray, I just want you to kind of take note, because we're going to talk a little bit about arthritis, is this x-ray. And if you can ever get the x-rays, or I tell all my patients that they should have their x-rays, they should have their MRIs, so that they just have it and they can then share it with their trainers or their other movement specialists, so that you have an idea of how the joints are moving. But here, the joint here, we see some joint space narrowing. So this joint actually is not going to have good range of motion. It's not similar to the picture that's here on the right. They would actually have limited or an inadequate amount of dorsiflexion, and you can tell that from the x-ray. Okay, but that's what we're looking at, the great toe joint. So how do we start assessing the big toe so we can determine the potential of power output during propulsion? So there's a lot of different ways. If you Google assess the big toe, great toe assessments, there's a lot of different techniques that people come up with. Some of them are going to be open chain, and some of them are going to be closed chain. You should be doing both, and I'll go into why you should be doing both, but some are, of course, better than others. Some will actually translate to function a little bit more than others. And I will revisit this page so that we can go into it. Okay, so to answer this question of what is the best great toe assessment, you must first understand how the great toe joint dorsiflexes. You must understand the biomechanics of the great toe joint to then further understand what's the best way to assess it. So there are 3 phases or subphases under great toe dorsiflexion. And this is really important. If you can grasp this concept, you are going to rock it out with all of your clients and athletes. So every time you bend your big toe back and every time you push off, what's happening is that your great toe joint is going through a sliding, gliding, and jamming subphase. Every dorsiflexion, your great toe joint slides, glides, and jams. What happens in some people when they get pain, like a capsulitis or a synovitis in the great toe joint, is that they are jamming or entering the jamming subphase too early. And then they pinch the capsule and they get an itis. So if we look a little bit closer, and you can see a little bit from the picture on the side, and then maybe you could play a little bit with your foot, is if you look at the first 0 to 20 degrees, what's happening is that you're having the sliding. So all that's happening is the metatarsal head is sliding on the base of the proximal phalanx. So there's just a little bit of a slide. Okay, you're setting yourself up for greater dorsiflexion. The 10 to 50 degrees, that is your gliding phase. Now what's happening, this is the most important phase. What's happening in the gliding phase is that your first metatarsal head is actually plantar flexing. So if we look at this image here and try to capture the visual if you can, first 20 degrees, all you're doing is essentially priming your big toe for dorsiflexion. You're sliding it, head slides against the base of the proximal phalanx. 10 degrees to 50 degrees, where you're going to bring the foot up this way. What happens is the first metatarsal head plantar flexes as the foot is going forward. So foot goes forward, and that first metatarsal head must plantar flex. That allows the first metatarsal head and the base of the proximal phalanx to run right next to each other. The last phase of the jamming phase is simply what it's stating, is that you're getting into that last one and then you're compressing. So there's a little bit of a slide, and then the plantar flexion of the metatarsal head, and then compression or jamming. That is what's happening every single time you take a step. And again, the phase where it gets a little sticky is that 10 to 50 degrees where you're entering the gliding phase and you're doing plantar flexion of the first metatarsal head relative to the proximal phalanx. So again, you want to think about anytime you're doing an open chain assessment, right? Anytime you're doing one of these open chain assessments, you are moving the digit relative to the metatarsal head versus the metatarsal head moving relative to the base of the proximal phalanx. It's different. So now we're going to start thinking, and you could deductively see that some of those assessments that I'm showing are not accurate. So first metatarsal head plantar flexion, this is where we need to optimize our biomechanics, our foot biomechanics, or our foot function. How your first metatarsal head plantar flexes is related to what's called first ray stability. Your first ray is the metatarsal here, the cuneiform, which is this bone here, running into the big toe joint. That is referred to as your first ray. Now, the part of the first ray that you need stability at is the metatarsal cuneiform joint. Metatarsal cuneiform joint is important to how you push off of your big toe. Now, the way that you stabilize your metatarsal cuneiform joint is through the spiral line. So you guys probably suspected that there was going to be a little bit of fascial lines in here, especially if I mentioned Dr. Perry. You know I'm going to be talking about fascial lines. And he loves the spiral line, and he loves the great toe because he understands that they're deeply connected. So your spiral line has, if we look at the picture here to the left, you have the tibialis anterior on top, and it's running into the Peroneus Longus on the bottom. That's going to be your sling, and that's really what controls your first metatarsal position, and that's what dictates how you get over your big toe. So if we look a little bit closer, on top of the first metatarsal, you are going to have the anterior tibialis, or the tibialis anterior. Your tibialis anterior inserts on both the medial cuneiform and the base of the first metatarsal. But what's interesting is that 90% of the tibialis anterior inserts onto the medial cuneiform, with only 10% inserting on the first metatarsal. So on top, you have your met cuneiform joint. On top, tibialis anterior, but a majority of your tibialis anterior is not on the metatarsal, it's on the cuneiform. Now, if we look at the Peroneus Longus, which runs across the bottom here, it's going to insert on the first metatarsal as well, and the medial cuneiform, but a majority of its insertion is going to be on the metatarsal. So it's on the bottom of the metatarsal with the majority of its power going through that metatarsal, whereas on top, you have the tibialis anterior with 90% of its power going to the cuneiform. If we go back to big toe dorsiflexion, the phase of great toe dorsiflexion that we need to focus on is the gliding phase. That gliding phase is controlled by the first metatarsal head plantar flexing. What plantar flexes the first metatarsal head is your Peroneus Longus tendon. So spiral line balance is very, very important. If you guys can see on this x-ray, do you see how this first metatarsal is actually elevated? That means that there is not balance or sufficient balance between the tibialis anterior on top and the Peroneus longus on bottom. So their spiral line, this patient or client's spiral line, would not be balanced. So you can actually see based on the x-ray that they are having issues entering the gliding phase of dorsiflexion, which means they jam too early. When you jam too early, you also create all of these spurs. So you see a spur here, you see a spur here. They have no joint space. It's completely arthritic. They would have an altered propulsive phase. They would have decreased power. And the reason that they have that decreased power is they do not have spiral line balance. That is always the goal. If we look at this foot would be a little bit how this x-ray would look. So if you're not used to looking at x-rays, totally fine. Know that this x-ray right here, essentially, if we rotated that foot and we looked at it from behind, would look like this. So we can see, do you see if you look on the inside here, do you see how the metatarsal is almost like lifted up, right? That would be considered a dorsiflexed first ray. The first ray is dorsiflex, which means now when they're going to go push off, there's not balance in the spiral line, and the Peroneus longus is going to have a hard time pulling that first metatarsal down in time for the gliding phase. They would have compromised propulsion. Okay, so here, this is another one. So we see that this arch is decreased. So you would suspect that it would be the opposite problem of the first picture, which is kind of correct. Anytime you have a everted or a flat foot or a decreased arch, what happens is you get a break in the first ray stability. So this client or patient has lost their met cuneiform stability. Part of the reason why they lose their first metatarsal stability has to do with the eversion. Now, what happens when you evert your heel, you put all of your everters into a shortened position. So if you, again, helps to kind of move through this, is if you're looking at your foot or you're focusing on your foot, you're touching your foot, is if you move your foot into eversion, you can see that you just shortened your peroneals. You shorten the lateral head of the gastroc. But because your Peroneus longus tendon runs across the bottom of the foot, it's a very long tendon. As soon as you go into eversion, you actually put your tendon on slack. So in this foot position that we see, yes, it's everted, and yes, the peroneals are short and tight, but the tendon of the Peroneus longus is actually on slack, which means that it's not, you don't have that great length tension relationship for it to plantar flex the first metatarsal. So then you would also see jamming in this patient, and you would see the different types of push-off. So both this foot type and this foot type would have compromised great toe mobility. So if you see this as a client and you're assessing them, or they're your athlete, and you start to do great toe mobilization drills and you put a little wedge underneath the big toe and you're not even looking at the spiral line or that subtalar joint position, you're not going to get anywhere with them. So understanding this concept is very important. So now that we understand that, we can better start to explore our assessment techniques. So we have open chain, we have closed chain. The purpose behind the closed chain or behind the open chain is that what you're doing is you're really looking at joint integrity. You want to see if there's any arthritis present. And you're really not doing it for like a diagnostic range of motion because it's not really mimicking the way that the great toe dorsiflexes anyway when it's on the ground. So think of open chain much more like, okay, how's the joint moving? Is there any crepitus? Crepitus means arthritic, so it's little like crunchies that you would hear. So almost like if you have arthritis in your knee and you feel that grinding, that's crepitus. You also want to see if there is a bunion present. If there is a bunion that deviates that patient or client's foot or great toe joint off of the cartilage or off of the joint line, so their push-off will always be compromised because their joint is not in proper alignment. We'll talk a little bit more about what you can do with that client. So again, how's the joint feel? Does it move? Okay, great. Can you feel any arthritis on the top of that joint? If you do feel arthritis on the top of the joint, that could physically block the dorsiflexion. Is there any crepitus, and is there a bunion present? When we start switching into the closed chain, now this is where we're going to get a little bit more accurate representation of dorsiflexion. So I like to do this assessment on the left. And what I'm doing is, one, I'm looking at the height that they can come up. I often do it on both a double leg and a single leg. There's a lot of other information that you can get from this assessment, but we're going to focus just on the transverse plane here, or on the great toe mobility here. So if we are here, one, you want to look at the height, so you're getting an actual degree of dorsiflexion. Do they have 30 degrees? Do they have 65? Maybe they have 90. But you're also looking at any deviation off of that great toe joint. If we look at the image to the left, you can see that this client is deviating away from that great toe joint. She wants to get off onto the lesser digits. So she is not pushing really straight through that sagittal plane or through that great toe, which, as we know, has to really kick in that plantar fascia to get that optimal spiral. Any of that deviation, think of it as extrafleurious movement. We want to be nice and tight and controlled. Stay over those 5 metatarsal heads nice and even. Stay over that lever nice and tight. Any deviation off of the side because of compromised mobility, extrafleurious movement. So we can also, from that picture, you can see the coupling between the dorsiflexion and the subtalar joint inversion. So her spiral is working. She just is deviating a little bit to the side. Now, if we look at the picture on the right, this is starting to go into really the topic of the webinar, which is high gear versus low gear push-off. Now, there's 2 types of push-off, high gear, low gear, and all it means is how are you pushing through that sagittal plane. Now, if we look here, we can see that the picture on the left, that is what's called a high gear push-off. It's optimal. It means that you're getting a maximum locking of the foot. You're getting maximum spiraling up through that lower extremity, or you're getting maximum power release from the ground up. High gear push-off. If we look to the right, you can see that this person is deviated. Yes, they're deviated in the transverse plane, but you can see that they're going to be pushing off of the side of the great toe versus pushing through the tip or all the way through the distal aspect of that great toe. There's a little bit of a deviation, a little bit through that side. And you could then see a little bit more of what this is going to do to the joint coupling. Now, if we look at it from an anterior view, just so you get used to posterior view, anterior view, you can greatly appreciate the difference between these 2 push-off positions. Now, the one on the right is still in late mid stance, so I understand that she would be a little bit more with the heel elevated, but you can see already the way that she's going to push off of that great toe joint. On the left, right through smack the center of that great toe, sagittal plane, optimal lever position. The body weight is evenly distributed across all metatarsal heads. That is what we want to achieve. That would be that high gear push off. On the right, you can see that she's going to go around the side of the big toe, not going to get peak contraction of the plantar fascia, not going to actively engage that windlass mechanism. And we'll see a little bit more about what this does to the subtalar joint. So that negative impact of the low gear push-off. of the picture on the right, what is the negative impact? Well, this is obviously going to impact our lower extremity, transverse plane, power, and that spiral. And there's a great exercise that one of my master instructors does, and so I'll have to kind of talk you through it, is if you get into, let's say, like a push-off position. So let's get into this position right here, the picture on the left. So you're about to like push off. I'm going to do it with you. So right here in this push-off position, I want you to compare how you feel when you are over the lever arm with that back leg. So you're over, you're in line, you're in that sagittal plane with your 5 digits or your 5 MPJs. You're there. You can already feel that you're so much more stable. I want you to push off and take a step forward. So take that back leg, get it maximally in that high gear push-off position. Feel how locked and solid you are, and then step forward. Get an idea of the power that you're able to generate. Now I want you to compare that to the low gear push-off. So you're actually going to get into a position that looks like the image to the right, or as we can see the image to the right here. So you're going to deviate your back foot off of the sagittal plane and just start to deviate it externally in that transverse plane. So now you're on the side of the great toe. So you can see in that position, you're not going to feel as stable. One, you actually lose a little bit of contact with the ground with the lesser digits, which would compromise your windlass mechanism. So you're there, feel your sense of power there, and then step forward. And compare. So my master instructor, who's a coach for Georgia College, he does this with his athletes so that they understand when he's emphasizing the importance of push off and like really lock the foot and high gear push off, so that they understand and are like, yeah, coach, that makes sense. I feel much less power when I'm in that low gear position. So something that you want to think about, and you could also emphasize that with your clients and athletes. So the joint coupling that's happening in that low gear push off position is that we're deviating. So you're actually getting minimal hallux dorsiflexion. You're not getting that peak dorsiflexion that we need for power output. What often happens with a low gear push-off, so don't think about the plantar flexion and the other coupling, but a low gear push-off is classically associated with subtalar joint eversion at push-off. You should always be pushing off of the foot in an inverted locked position. As soon as you push off of the foot in an unlocked, everted position, is you start to compromise the way that forces go through the foot. This is where the risk of injury goes very high. A lot of the shin splints that I see, different plantar fasciitis, Achilles tendonitis, different sprains, great toe, bunion, capsulitis, etc., etc. It can go all the way up into the knee, patellofemoral pain. It compromises a lot of force production, but the way that your body handles that force. So just remember, if there's one take-home point, low gear push-off means you push off and you release power on an unlocked, unstable foot. That makes you susceptible to probably every injury that is out there. Plantar flexion, yes, we know that that still exists. But we know that subtalar joint eversion is coupled with tibial internal rotation. However, when we are pushing off, we are supposed to be going through external rotation spirals. But now in a low gear, you're going into this internal rotation spiral of your lower extremity or your knee down. Your hip and femur are still going into the external rotation spiral, but your tibia is going inward. So do you now see that your spiral is going essentially in two different directions? This is going to put a lot of stress on the knee joint. You want to have a nice sink tight spiral. If it's going in two different directions, some joint is going to take the brunt, and that's going to be the knee. So we want to think about this and the impact of that low gear push-off. This mismatch or this asynchrony spiral is going to compromise power output. They're greatly going to have decreased output. And again, it's for all athletes, it's for all clients. If you start thinking about the way that someone is pushing off, I started doing all this research with swimmers, which is why I have so many swimmer pictures in here. But it was quite fascinating that they're on the blocks and they're barefoot, so they also have no shoe that's blocking their range of motion, so they can really get some good contact. If you work with swimmers, reach out with me, because I want to start to kind of tap into that area a little bit more and work with these athletes about how they're really moving through that digit and how they can actually optimize their power. If they're switching direction and pushing against the wall, think about how much that difference in power would be between a high gear push off of that wall versus a low gear push off of the wall. And you will start to see many, many other applications of this. Wherever anybody is leaving the ground, that's a way that you can apply this. So when we start thinking about correctives and programming, what I would recommend is to start by looking at the subtalar joint. Do they have an inverted subtalar joint, or do they have an everted subtalar joint? If they have an everted subtalar joint to the degree that it's compromising the inside or that first ray, just know what that does to the spiral line. It puts the Peroneus Longus tendon on slack, which means it cannot stabilize the first ray. If your first ray is not stable, you cannot put force through that joint or through the foot. So the way that you would start correcting that would be get that subtalar joint back into a neutral position. Whether you are doing glute strengthening, you're doing short foot, you're doing orthotics, just understand the purpose of neutralizing that subtalar joint. If they are more inverted, so the other example that I had given where that first metatarsal was elevated in that very inverted foot, what I would do is focus on mobilization. I would really release that tibialis anterior and all of the inverters to get them more into a neutral position. They're just very rigid and we need to loosen them up so that that first ray or that first metatarsal can drop down. Second thing that you want to start looking at with your correctives and your programming is there a bunion present? Depending on the size and the severity of the bunion, they may have compromised joint space. So you may want to work with a podiatrist to get some x-rays, really look at the joint and see what is their potential within that big toe joint. There is something, and I would write this down and maybe explore it a little bit for some of your clients. There's what's called a reverse Morton's. So it's a reverse Morton's extension. And essentially what it is it's a dropout under the first metatarsal head so that it can drop down. If you have somebody that has a compromised biomechanics and compromised actual joint and is very limited, this is usually a great way to help them get a little bit more range of motion. That cutout or that dropout, that reverse Morton's extension, what it does is it assists the plantar flexion, or it assists the gliding phase or the plantar flexion of that first metatarsal head. So I actually really like that modification much more than the wedge that I see a lot of people putting under the great toe. When you put a wedge under the great toe, essentially what you're doing is you're putting them through that sliding phase earlier, which it helps in some cases. There's a wedge that's called a Cluffy wedge, which is what they're using, C-L-U-F-F-Y, Cluffy wedge. And it's a modification that you do in a lot of orthotics when somebody has limited dorsiflexion. I typically do it when a patient has more like a rigidus, and it just gives them a little bit of a rocker to go over versus modifying or doing anything to the spiral line. That Cluffy wedge does not do anything to the spiral line. So if there's any arthritis present in the great toe, that's something that you want to think about. That would be a little bit more towards a structural compromise to the great toe. So you would want to understand the potential of your correctives may not be as great if they have severe arthritis in the joint. So you kind of know what you're working with and you have a realistic expectation for your results, and you could explain that to the client as well. If there are any other gait abnormalities present, you also want to take that into consideration. I did a video posting on Monday where I spoke about tibial femoral external rotation. And tibiofemoral external rotation is often present when there is a low gear push-off. So if you want to learn a little bit more about that, it was posted on YouTube and the social media. You could check that out. See a little bit more about how that rotation at the knee joint can actually compromise push-off as well. So I will take any of those questions. This is designed to be a little bit of a teaser so that you start looking at the great toe joint a little bit differently. Something else that I would encourage you to do is I wrote a 3-part blog series on the great toe. And it's the most recent posting that's on the blog. The blog is barefootstrongblog.com. If you check it out, 3 parts. I go into the anatomy and biomechanics, I go into the assessment techniques, and then I go into the correctives and the programming. So it would be a perfect adjunct to what we went over today, and it would be a review plus some additional information. So let's see if there are any questions. Let me see. So there's a question that says, what do you do when a high gear push-off position makes a client unbalanced due to years of a low gear push-off? For this, I would look to see if they have tibiofemoral external rotation. And what I would do is, I speak about it in the blog and I speak about it in this video. So check that out a little bit more. You may need to correct the knee to foot alignment so that they feel a little bit more centered. And it takes a lot of time. If you're thinking that somebody's been pushing off of a low gear push off for 20 years, you can't just say like, hey, go walk straight, right? It takes a lot of patience and soft tissue work and reversing kind of that connective tissue way that the body likes to transfer forces in that individual. So it does take a lot of time, and you might not get to an optimal, perfect high gear push off, but you may be able to help them. So I would definitely say by doing that, and you can even start by just doing their lunges, or they're doing any sort of triple extension that goes all the way into the digits, and have them really focus on that big toe. So you could integrate it through like kettlebells, etc. Very good question. So if our great toe is so important to have a high gear push off, does it mean that our smaller digits in the feet are not functional or they are not important? Well, I would never say that. They are important for balance. We need all of our digits, and we know that all of our digits are connected through the plantar fascia, and a lot of our fascial lines fan out and insert through the different digits. So it really is an accumulative process of that lever. So just think about, the great toe just keeps you in the sagittal plane, but the lesser 4 digits is the supporting team to your lever and that stability of the lever. So yes, definitely still need those lesser digits, and balance, huge. So does the interaction of the spiral line between serratus, structures, obliques, etc., tibialis anterior, the reason why we must point our toes when we do some gymnastics exercises like handstands? It definitely affects it, and you can start to play with that a little bit. Is the more you understand about the fascial lines and how they run from proximal all the way into the digit, is you can think about, well, what if I dorsiflex? What if I point my ankle? Depending on what you do with the foot will influence these fascial lines. So play a little bit with it and see. It's actually much less about the digits and pointing the digits. And I find this when I teach a lot of my core conditioning, is that I will have people point the ankle, but not point the digits. So play with that a little bit as well. I actually like an ankle point, not a digit point, when doing core training. And that could be with some of the dorsiflexion as well. So, but yes, everything is influenced, everything is connected. So if your cueing includes the foot, that is great. Would a cavus foot be more prone to a low gear push off or a high gear push off? I would say a little bit more towards a low gear, only in the sense that a cavus foot really was that picture that I had shown, that high arch where the foot was, or the first ray was elevated. That was, you could put that under a cavus foot. So everybody's foot is a little bit differently. So just think about it in the different parts. But if you're not familiar, if you've never heard the term cavus, it just means high arch, often inverted. Think about the picture that I showed. In that case, they would have a low gear push off. Yes, so there was a question on the reverse Mortons. So there's what's called in orthotics and podorthics. There is what's called a Morton's extension, Morton. So almost like a Morton's neuroma or a Morton's foot or a Morton's toe. Think Morton's extension. The Morton's extension actually went all the way through the great toe and it blocked your dorsiflexion. And those are used in the case of someone who has a very painful arthritic great toe that you're just trying to block all their motion. You put like a graphite bar through the shoe, you want no dorsiflexion whatsoever because it's that painful. Think that that's what a Morton's extension is. So a reverse Morton's would be a cutout. Something that is very similar to it would be a kinetic wedge. So if you Google kinetic wedge, that will bring up some information. A reverse Morton's. And even in like a pinch, I will use a dancer's pad because that allows the first metatarsal head to drop. Any padding, cushioning modification that allows that first metatarsal head to drop is giving a biomechanical advantage to the great toe joint. And that's where you would use it. In some people it works, in some people it does not. Okay, so in pronation or eversion, in addition to the correctives I already mentioned, would you also strengthen the Peroneus Longus? I generally try not to do this because it throws them even more into eversion. So the way that I would strengthen the Peroneus Longus would be through much more through a locking exercise, a foot locking exercise. One of my favorite exercises that trains the foot to lock is if you are doing a calf raise, right? So you're doing heel raises or calf raises. If you take a tennis ball, a lacrosse ball, etc., and you put it between your heels but behind your ankle bones, and so you're placing it there, you're squeezing the ball between the heels, and then you're coming up into a releve or a heel rise position. But as you're lifting, you want to think about pushing the digits down, driving the heels together as you're coming up. So that locks the foot. So as you lock the foot, that will essentially or ultimately be strengthening the Peroneus Longus. The Peroneus Longus, yes, plantar flexes your ankle, and yes, everts your subtalar joint, but I would focus much more on just getting that foot into locking through the inside, and then indirectly you are strengthening it. That's the way that I would approach it. And I would encourage you to explore that as well. If you have a question with that, please let me know from a visual perspective. Can short foot help with arthritis in the great toe? Most likely no. Reason being that arthritis in the great toe joint is often associated with joint space narrowing. So you actually get a tighter and tighter capsule. Arthritis in the great toe joint is very, 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 very difficult to deal with. Once you have it, it can be quite progressive, and there's no natural way to get rid of it because the great toe joint takes so much load and so much stress, and the way that that joint moves is very different from other joints in the body. So always remember that it slides, glides, and jams. So really when you're sliding and gliding and jamming on a joint that has very little cartilage, it can be very painful, and the rate of osteophyte or spur production is very high in the great toe. So I love short foot, but unfortunately it does not help arthritis. Would a low gear push off lead to Achilles tendonitis? It can. I would blame that a little bit more on someone who has a low gear push off, typically is associated with a very unlocked foot. So if they are pushing off of the foot when it's unlocked, chances are they are striking the ground with it unlocked. And they're essentially just staying unlocked the whole gait cycle, or that whole contact through push-off phase, that we get Achilles tendonitis when you strike the ground on an unlocked foot. So I wouldn't blame the low gear push-off. I would say that there are two conditions that are associated with an unlocked foot. So your goal ultimately to correct both of those is to train and get that foot to lock better. When you have someone that you encounter with a mixed low gear, high gear pattern, which takes precedence in correctives? I would try to do it all in conjunction, mixed SIs. Not really understanding the question. So if Layla could type that in, and then I might have a little bit clearer concept. So this is a very good question. So one of the listeners, Doug, is working with pitchers, a fast pitch pitcher. And when she comes off of the mound, coming over the big toe would increase the speed of her fastball by engaging the glutes. Yes, that would. So that's another example of where we have to look at every aspect of power output, even the way that that foot is in position with the ground. And that's where you look at the push-off. You may not find anything written about, high gear versus low gear push-off with pitchers, but you can apply that exact same concept. If that foot is in relation to the ground and they're getting dorsiflexion, you need them to be in a tight spiral, and that's going to optimize the glute, which translates to the pitch. And to upper body strength is definitely related to what's going on with the ground and the way that your foot is positioned during power output. So 100%, great question, Doug. What does plantar fasciitis say about great toe mobility? You really can't find a connection between it. Reason being that, very similar to the earlier question, is that plantar fasciitis is much more of a contact injury. So it would be something with how they're contacting, so contact phase, where great toe and push off, we're looking at the distal propulsive phase. So one is when energy is coming in, one is when energy is coming out. Again, you can have two issues. Are they connected? No, but the reason is probably the same for both of them. So, to improve a high gear push off, I would use the exact same exercise that I said a little bit earlier with the ball between the heels. That is the best exercise for training push off position. That actually trains the spiral. I think I have a picture of it in the blog. I don't know why I didn't put a picture in this, so I apologize. But the ball between the heel, and you're doing heel raises, pushing the digits down and driving the heels together. I will create a video and post it and send it out related to this so you guys can see exactly what I mean and you can see the cueing for it, but it's a very powerful exercise. When in open chain, if the, Peter forgot half of his question. In the open chain, if the big toe can be dorsiflexed almost too much, the first ray plantar flexes further. Yes. Would this reduce power? So yes. So what Peter's asking is, in an open chain, if you just bend the big toe back as far as you can actually feel that the first metatarsal head is dropping down. And if you do that on your foot now, just at home or wherever you're listening to this, and you just put your foot underneath the metatarsal head and use the other hand to dorsiflex the big toe as far as you can, you will feel the first metatarsal head plantar flexing, that's great. Understanding that concept, huge. Why that doesn't translate, Peter, to closed chain movement and your actual dorsiflexion that you have is that the ground gets in the way. So you will never have that much dorsiflexion, or it's not a true representation of your closed chain dorsiflexion, because all that plantar flexion would be blocked from the ground. So just take that assessment much more for the integrity of the joint and seeing if there's any crepitus, arthritis, etc., versus, oh, my client has, 60 degrees of dorsiflexion. Okay, great. Okay, so try to look at it a little bit more that way. So low gear push off, slow man, and we'll do a couple more questions and then we're almost done. Yeah. Yes. So does a low gear push off, say you're imagining somebody who's running really slow, which this is classically how some people run, where they could probably walk faster than they're running, and they're just running so slow that the biomechanics, and they're in this low gear push off, and they have tibial-femoral external rotation, and their glutes are not firing at all. And if you look at someone like that, like a slow marathoner is what was used as the example, is they probably have absolutely no hip extension going on as well. So they're very anterior dominant. They have no great toe dorsiflexion. They're in a low gear push off. The foot is completely unlocked. They're muscling their way through it. They ultimately get injured, which is unfortunate. So someone like that, 100%, you would want to correct them. And yes, so I will send a video. Let's see, priority for shin splints. So shin splints, very good question. Shin splints would be a little bit more associated with a low gear push-off, only because a low gear push-off is associated with an unlocked foot that would translate into contact. So shin splints would be more of a contact injury versus a push-off injury. But since we're here and we're talking, shin splints, yes, look at the push-off, but look a little bit more at the contact and what their foot type is just off the bat. If they have eversion and they have uncontrolled deceleration, that's most likely why they're getting the shin splints. And then they probably have a low gear push-off as well. So if I did not answer your question, let me see if there's one more. Otherwise, we are good to go. If I did not answer your question, I apologize. Please do know that you can always email me at education@EBFA Fitness. If you want a copy of the webinar, I have absolutely no problem giving or sending the locked PDF of the course. I know a lot of people actually review it. They hold on to them, and I want you to understand these concepts. If you do want them, then please email me, education@ebfafitness.com. Please check out our education calendar, where we will be all over the world, very excited with our team of master instructors. And we are launching in the Middle East this year in September and October. So that is very exciting as well. I want to thank everybody again for tuning in. Please do stay tuned. I will be sending out a video with that exercise. I will be posting this on YouTube, and then we will be posting shortly what the next webinar is. If you ever have any suggestions or recommendations of what you would like to see a webinar or who you would like to speak on any topic, please email me as well, education@ebfafitness.com. Thank you all so much. Have a wonderful night, and we will see you again soon.